Assalamu alaikum, everybody.
Walaikum assalam.
Maybe we'll give a few more minutes for people to join. Inshallah, we'll start. Let's see, once Hoda joins, let me text her very quickly. Okay. Let's just check if, okay, great. I see Hoda's iPhone. I believe that should be our Dr. Eltomi. Is that correct?
There she is.
You see her?
Yes.
Yay. Okay, great. Assalamu alaikum.
Alaikum assalam. How are you?
Alhamdulillah, how are you?
Alhamdulillah.
So it looks like we have a good number of participants. I think we should, inshallah, get started. Assalamu alaikum, everyone.
Walaikum assalam.
Alaikum assalam wa rahmatullahi wa barakatuh.
If this is your first time joining the community Q&A forum that ICNE is doing, welcome. This is part of the larger host of virtual programs that ICNE has put on to allow us to interact with each other when we're homebound during these very interesting and unprecedented times. Today, so during these Q&A forums, we focus on some pertinent issues and issues that have arisen due to the coronavirus. Last week, we had Sister Malika from ICNE Relief discussing the local and national relief work efforts. And today we are very excited to have two very knowledgeable gems in our community, Dr. Hoda Eltomi and Dr. Ujala Fawad, who will be both sharing from their respective medical points of view some helpful tips and kind of what they're seeing due to the coronavirus. And we'll then, after each one of them shares a little bit about what they're experiencing, we'll open it up to questions from you all. And feel free to raise your hand to ask a question. There's a raising hand function on the Zoom, or type in your question on the chat in the chat box, and we'll read those to Dr. Hoda and Dr. Ujala, inshallah. So before we get started and asking you questions, I just want to share a little bit about your backgrounds, if you don't mind. And I'll start with Dr. Hoda Eltomi. She is a ABFM board certified family doctor who practices in Weymouth, Massachusetts. She works at Harvard Vanguard Medical Associates and is a clinical instructor at Harvard Medical School. She completed her medical training at Brown's Medical School and has practiced in the South Shore area for the last 10 years. She served as maternal child health chief resident on her program and has special interest in maternal and child health as well as weight management. Welcome, Dr. Hoda.
Welcome. Thank you.
And Dr. Ujala Fawad is an ABPN board certified psychiatrist who completed her psychiatry residency training from Harvard Medical School. She served as administrative chief resident in her 4th year of training. Dr. Fawad provides her patients with a spectrum of care that includes supporting them through their psychological, emotional, and physical needs. Her areas of interest include working with patients who suffer from post-traumatic stress disorder, depression, ADHD, bipolar disorder, and anxiety. She also has experience working with patients suffering from serious mental health issues, including schizophrenia, as well as suffering from substance abuse. She has experienced both inpatient and outpatients at local hospitals, and she finds making connections with her patients and improving their quality of life to be extremely rewarding. And we're very grateful to have you both here to talk, taking up some of your weekend time to speak with our community, which is your community. You've both been around the sharing community for years and have been serving, mashallah, in your outside of your respective medical capacities. So just want to get a perspective from each of you from what you're experiencing now. What you're both in a big way on the front line serving patients from a family medical perspective, from a psychiatry perspective. What are some of the things that you're experiencing with your patients? What are some of the trends that you're seeing right now due to the coronavirus and this whole pandemic that you can share, kind of a highlight of what the trends are? Because we're all locked up in our homes. We might not be realizing that everybody's experiencing some of the same things. So I'll start with you, Dr. Ujala, if you could share some of the trends that you're seeing.
So we are seeing a lot of uptick in both depression and anxiety symptoms, both in our patients as well as the general public. People are anxious for different reasons. Some people are anxious because they're inside their house alone and they have no social interaction whatsoever. Other people are anxious because they have serious health issues and they are considered to be high risk. If they acquire the infection, they might have harder, but worse outcome than the general public. Then people are also anxious because some of them live there with their elderly parents, and they are worried that if they go out and they go back to work, they might bring the infection home and might infect their parents or their little children. Then a lot of people have also either lost their jobs or they've been laid off because of the the profession they were in. They're unable to keep working at this point, and financially, financial problems are also a big reason for people to be anxious right now.
Yeah, for sure. Dr. Hoda, would you like to give us an overview, a little bit about the trends that you're seeing right now with the patients?
Assalamu alaikum, Suzanne and everyone. Jazakallah khair for the warm introduction. I want to start off by just saying, I wish you all to be in the wake of this pandemic in good physical and mental and emotional health. Inshallah, something good will come out of this.
Inshallah.
I just want to say that, so I'm a family doctor by training, and I usually see well visits and non-acute visits. And what is happening to us now is that our practices are sort of being redeployed to an urgent care setting where we're mostly, seeing patients who have urgent medical problems that are either COVID related or non-COVID related. I'm also on a pool, and I get a little bit of what Dr. Ujala was saying about the anxiety and the depression. I'm on a pool answering questions from the greater community about what does this mean for us? People having symptoms and wondering if they have the illness, so I have been seeing there's a lot of anxiety, there's a lot of illness out there. Alhamdulillah, we haven't seen the surge of patients yet that is being seen in New York, for example. But we are currently in Massachusetts on an uptick of the exponential curve. I know many participants may have been seeing this online or in social media, seeing the curve and flattening the curve. People have all sorts of questions about what does the curve mean. Basically, the top part of the curve is how much our medical capacity can handle. Alhamdulillah, so far, we have been able to handle, our medical capacity has been able to handle the cases that are coming to us. And this is alhamdulillah, and this changes on an hourly, on a daily basis. You know, in the last 24 hours. So we don't have numbers from Massachusetts yet today, but there has been over 1,000 cases just in yesterday, like in the last 24 to 48 hours. Results I usually posted at 4 p.m. So we don't have numbers from today, but we are on the uptick. So right where everybody's so bored, everybody's sick of staying at home, everybody's so anxious, there is no time better than now to just stay at home. You know, subhanAllah, you know, this is the time where everybody wants to leave, wants to get out and scream, you know.
Cabin fever kicking in.
And yes, cabin fever. But this is the time that I urge everybody, you know, everybody to just stay home for the sake of yourself, your loved ones. Only go out if absolutely necessary. You know, it's very important to keep with being patient, and you know, just like the verse in the Quran says, you know, keep with patience and prayer. You know, so be patient and keep praying. That's all. You know, that is all I'm asking. Just as your sort of community doctor, just stay home and you know, exercise all the appropriate hygiene measures, careful hand washing, very important, for at least 20 seconds, socially distancing yourself. If you're sick of staying home, you can go outside. It's actually recommended that you get some fresh air, both physically and mentally. You know, so going outside is actually okay, but as long as you are distant from other people. You know, making sure that you are, you know, exercising proper hygiene, especially when it comes to touching your face. Try to avoid touching your face at all, like, you know, at all times, and always wash your hands before eating or consuming anything. If you need to leave the house, you know, making sure that you are exercising caution, you know, removing your clothing. Mashallah, yesterday I was reading through Dr. Shima's updates, and they're very helpful. I don't know if everyone here is on the group, but mashallah, he sent a lot of like written tips that, you know, they're very, very helpful. If you haven't read them already, please read them. So that's all we can do, you know, just try to control what you can control, and whatever you cannot control, just let go of that and let Allah take the lead on it.
Yeah, Jazakallah khair. I guess that's the true essence of Islam, submission to Allah's will. This is really outside of our capacity and control. Thank you for sharing all of those helpful tips. Dr. Ujala, from the control perspective that Dr. Hoda just ended on, it's really difficult sometimes to let go of what we find comfortable, and this perhaps has triggered some feelings and emotions and anxieties in people. Could you speak a little bit to that? You know, this feeling of loss of control and normalcy and comfort. What tips can you give people?
So, you know, it is true that we have a lot of, everybody in this world has kind of lost control of normalcy, and it's a very different time, and it's the kind of time that I think no one has experienced. Most of the people living in this world right now, they have not experienced anything like this, where the entire world at the same time is dealing with like a standstill situation. Yeah. So, you know, and this is where, I mean, you know, even when we talk about trauma, and we talk about the fact that, you know, there are times where people are not in control of everything all the time, and this is a time where a lot of people are not in control. But what we can control is how we react to the situation. So and then obviously try to find the silver lining in every situation. For example, a lot of people are feeling right now that they're stuck in the house and they have they can go to work, their kids cannot go to school, and their life is on a standstill. But there are things that we can do to find some sort of normalcy or control in our life. One thing that I believe is a good thing that can come out of this whole experience is that families can come together. We have more time on our hands to actually engage both with our children and with families in general, because we a lot of the other things that we were doing in our life, they kind of disappeared. You know, most of our weekends were spent meeting, you know, friends and socializing, and now we can't do that. But we can utilize this time to do family projects, play board games together, do things to engage your children. One thing I would like to point out is that we are all adults, and we're feeling that we've lost control of our lives, but we have to think about the children who are also going through a very different time in their life. They have never experienced this before. And they look up to their adults. We have to somehow give them this support, because if the children feel that their parents are depressed or anxious or scared, they are going to feel the same way. So we have to make sure that we engage with them, and we don't have the same kind of expectations also. Like, we don't have to make sure they're excelling in maths and physics right now. We have to make sure that they are happy and they are healthy and they are engaged with us, and they're not scared.
Those are all very helpful tips. And, you know, just, well, first I want to ask community members, if you all participants, if you have questions, feel free to type them in the chat box. There's a virtual hand raising. I'm not very technologically savvy, but there should be a little icon for you to raise your hand that we could, then we can unmute you. You can feel free to ask your question directly or type it in the chat box, and I can read it aloud to Dr. Hoda and Dr. Ujala. And in the meantime, I think we can just finish having a conversation. I can ask questions until we get some more from the audience, inshallah.
So I also wanted to touch base on a couple of important things, that when you are in the house, we still have to make sure we do 4 things. The first thing is that we need to maintain good diet habits. So we have to try, you know, a lot of people when they're home, they are like snacking and there's food, you know, we've all brought a lot of food inside our house right now.
Yes, mashallah.
We have to try to don't have it in front of you all the time. Try to have healthy snacks at home. Try to do exercise. Exercise improve endorphins, which improve mood. So, you know, you can go outside to walk, or you can exercise inside the house. If you have equipment, you should engage your children to maintain exercise habits. There are some, you know, websites online. You can look up how to do yoga or Pilates or other kind of exercises, but it's important not to forget about that. And then the other thing is good sleep habits. I know that a lot of people are dealing from insomnia right now too, because of the anxiety. And some basic things can help people with improving their sleep habits. One thing is to obviously stay in the good sleep-wake cycle. Try not to disrupt it too much. And then we can do relaxation exercises like mindfulness-based exercising, you know, other kind of relaxation exercises. There are some apps available which I can I'll try to post it in the chat here. Otherwise, we'll provide it later, where they have small exercises that you can do before you sleep to take your mind off of your anxieties, and definitely not try not to spend too much time on social media where everyone is talking about COVID-19 all the time.
Yeah, that's a really good tip. So one thing that, well, I want to ask about the healthy diets, because I know that Dr. Hoda is also interested in weight management. And then the other question that I wanted to ask based on what you just said, Dr. Ujala, is, you know, this change of, it's this new normal. And I think this is something that you had mentioned in the past, that, you know, we've told our kids, you know, certain things, don't watch TV, don't go online, don't use social media. And now we have these, what we've told them not to do essentially is yeah, it's a new life. Like, don't use a computer, but now their classes are all online. So how do you strike a balance with that? And then also wanted to, Dr. Hoda, please feel free to also jump in here. So.
I think one thing I would like to say is that, you know, as situations change, we have to adapt. So in the past, we used to tell our children not to spend time on computers or online because it was taking away their life, like real life interactions with other people. However, now the tables have turned, and this is the only real life you know, this is the only interaction they're going to get with their friends. So I've been actually encouraging my patients to try to FaceTime with their friends and try to have a, you know, even do like some kind of a, you know, group Zoom meeting or something like this, because this is the only way they can get in, stay in touch with their friends right now. So I think that sometimes we have to make decisions based on what we have available in our life.
Yeah, that's so true. And thank you to all of the ICNE volunteers and board for putting these programs together so we can have these interactions as well. It's been a real blessing to be able to see community members and do Ethkad together as well. Yes. Dr. Hood, I want to turn it to you.
Jazakallah khair. Yeah. So the thing is, you know, I think that, you know, sort of like what the conversation that we were having yesterday, Suzanne, you know, a lot of moms are reaching out to me. A lot of people are reaching out to me, like being frustrated with, you know, homeschooling and learning and the curriculum and the amount of like school meetings. And I think that establishing and having a routine is very good. It's, in fact, a lot of people a lot of like experts say, try to stick to a routine as much as you can with yourself and your children. Try to wake up at the same time, groom yourself as if you were going out. You know, it's very tempting to hang out in your PJs all day, but you know, it's actually recommended that you get out of your pajamas, get in, you know, try to treat it as a normal day, and that helps you and your children have a sense of normalcy. Mm-hmm. The other thing is, you know, trying to shift your mindset a little bit from the rigidity of the schedules, whether the ones posted on social media or shared. You know, I think it's good to have a schedule, but it's also good to be a little fluid. You know, trying to be a little flexible will help you and your children sort of digest this better. Just like Ujala said, it may not be the time to like sharpen your math skills, but this is a time where it's a very historic time. You know, our children can learn a lot from being in a pandemic and seeing how the world changes with that. You know, this can be an opportunity to read about past pandemics. This can be an opportunity to learn how to bake a cake together, or learn how to clean your room or vacuum, or like do something that is actually life skills that I don't feel that our kids get to experience on a regular basis. And now maybe the opportunity to teach them that. So, you know, being fluid and flexible is very, very important. The thing about weight management, I mean, you know, I'm on all these groups and all these spaces that, you know, people are sharing recipes, and it's so it's so awesome. You know, I think it's great that people are cooking at home and like, you know, and eating at home. This is really great. But, you know, one thing that I would caution people to avoid is impulsive eating, you know, so trying to, I mean, it's good. We need food in order to nourish our bodies. We need healthy food that is clean and cooked at home. Trying to incorporate recipes that have a lot of fiber to keep us full. Something that has a lot of vegetables, you know, helps give our bodies vitamins and all the minerals, healthy protein. These are all things that help our immune system and help us fight infections, you know, things, you know, herbal teas and things like that. These are all very good things. So we need to cook together, eat together, but we need to engage in this mindfully. And we need to avoid impulsive eating, which will probably lead us into a very dark place when this is over. So, you know, you know, a few things that I like to share with my patients about mindful eating, eating slowly, eating, you know, digesting your food appropriately. When you eat slowly, the messages, the signals are sent to your brain that food is available. So it calms the brain down. And by eating a little bit more slowly, we can actually eat less. Portioning, like eating out of a plate rather than eating out of a large bag or something like that, you know. And the other thing, like there are 4 tips that I usually tell patients to remember, like the 4 Ds with eating. You know, when you feel the impulse to sort of eat something or stress eat, which for a lot of us, stress, like food is a source of comfort. And so, you know, if you're eating, that's okay. Your body is seeking comfort in food. But if, you know, try to think of an alternate activity if you're feeling that impulse to eat something incredibly unhealthy. So, you know, the impulse, how to control the impulses, I like to talk about the 4 Ds. And the first one is taking deep breaths. Like if you're feeling very stressed and anxious, taking deep breaths. Distraction, try to do something that, you know, takes your mind off food a little bit. You know, I was reading an article yesterday about sort of managing, like just going back to the control issue. Most people have, you know, we have a sense of control. We want to have a sense of control. And so this phase where we can't control anything is very stressful for us. So actually, like doing an activity where you have some control is good. So organizing a drawer or organizing a closet or cleaning a space or something gives you some control and also can take your mind off eating a little bit. You know, so distraction, deep breaths, these are 2 Ds. Delay, so sort of saying, you know, do I really need that apple pie right now? You know, it would be good, but do I really need it now? Maybe I'll have it in an hour, you know, sort of delaying. And maybe in an hour, you won't want to eat it. You know, you're going to be like, oh, I'm okay. I didn't really need that apple pie. So delaying, and also drinking warm liquids, you know, sort of like fixing yourself a nice herbal tea. Like I'm getting all these recipes for like, you know, honey and lemon tea and boost your immunity and all that good stuff, you know, as long as it's not a sweetened beverage, like if it's something that is more natural, like an herbal tea or something that is sweetened with a little bit of honey, that also helps people feel full and hydrated and also helps boost your immune system. So there's nothing wrong with that. So yeah, I mean, you know, if you can't do all these measures and eating is your only escape, it's not the end of the world. It's okay. It's like, you know, it's about surviving this phase, you know. So if you can do these measures, then great. But if it's hard for you, it's okay. You know, I think, again, going back to being fluid and flexible and just going with the flow and letting go of the things that we cannot control, both physically and mentally, just letting go of that sense of control as much as we can, but also trying to embrace it in different aspects. So inshallah, may Allah help us all.
Ameen. Jazakallah khair. That was very useful, practical advice. I wrote down those 4 Ds, so I have them for, I'll put them on my refrigerator for after this call, inshallah. We have a couple of questions from the chat box here that I'll read. Brother Ahmadu wrote, Ahmadu wrote, if we are practicing stay at home, do we still need to wipe and sanitize surfaces several times a day? I'm asking because we want to preserve our cleaning supplies since we cannot find them in stores anymore. That's exactly, yes. Yeah. Very good question.
Yes, exactly. Yeah, so I mean, if generally speaking, it can be very overwhelming to just go around sanitizing everything, it's overwhelming mentally, and it's also overwhelming in terms of resources, so no, I don't think so. I think being wise about contaminated surfaces. So, if you are staying home, no one's leaving the house, hopefully the coronavirus has not entered your household. The thing is that I would caution people is that one of the unfortunate things about this nasty virus is that it has a very long incubation period where a person can be healthy. So before us staying home, if you were exposed to someone who seemingly was healthy but had the virus, they may
unknowingly,
yes. So it's always good, the most important time to control our hygiene is when we're about to eat and when we're about to touch our faces for any reason. So making sure that you are washing your hands before these times. Regarding surfaces, I think the normal cleaning that is like after eating, just wiping the table, or, just the normal cleaning that you normally do is sufficient to maintain that level of hygiene. Even with our personal bodies, the regular cleaning of our bodies is sufficient. We don't need to like bathe in Clorox or anything, I think that just taking a shower and just being mindful of the times where we're about to touch our eyes, like people who wear contacts, for example, wash your hands before putting your contacts in. If you're eating, wash your hands before eating. And washing your hands thoroughly is very important. I read something that was very interesting. So basically imagine that you had glitter on your hands. How would you wash them? You would wash all surfaces, the back, between the fingers, on the thumb and the wrist, so just sort of doing that, I hope that's helpful. I hope that answers the question.
It is very much so. It's kind of like the surgeons, how they wash their hands, both ways. Like that,
Exactly.
So there another follow-up question from Brother Ahmadu. Amadou, sorry if I'm totally butchering your name. How many hours of homeschooling should kids have per day? Age groups 3 to 5 and 6 to 8.
That's a very interesting question. So, if you, I mean, it all depends on shifting the mindset about what you consider schooling. If you talk to the moms who homeschool on a regular basis, you will realize that they are very relaxed with the concept of schooling. Teaching, like didactic teaching, is schooling, but also what I was talking about earlier, basically reading together is also schooling. Baking together, I actually, I encourage people to bake together. There is a lot of science and math involved in baking. When you put proportions, when you mix, there's so much science and math that you can teach by baking. So it really, I feel like it's almost harmful to define a number of hours. I feel like every experience could be a learning experience if you use it that way. In terms of didactic teaching, I mean, yes, it's necessary to learn English and to learn math. That is good. But trying to incorporate it in your everyday activities is actually also very helpful. So yeah, I don't know of a strict answer to that question. And again, you know, in terms of every child also, you know, one other thing that doesn't, you know, that makes me not want to provide a rigid number is because every child's needs and every child's learning needs are a little bit different. So, you know, what could be very overwhelming for one child could be like a piece of cake for another, and vice versa. And so, you know, it's, you know, as a parent, this may be your learning opportunity to, you know, to learn what kind of learner your child is. You know, is he a person that can attend to you for an hour or 5 minutes, or, you know, so I don't, you know, I can't say a strict number. I don't know if Ujala has any thoughts about that, Dr. Ujala.
I think there are two things. One is to not to try to overly control everything, like you said. And the second thing is that maintain a balance. So I think in my mind, I would say probably 3 hours will be enough. And it can be broken down into increments where you can do like math for 30 minutes and English for 30 minutes, and then you have a break and do some sort of activity together, and so on and so forth. But coming up with a schedule that work with your children, but not to overwhelm them also, because they will catch up. Everyone will catch up, inshallah.
Inshallah.
Inshallah. And everybody is in the same boat. So, so if your kid is behind, sure, a lot of other kids. But I'm sure that's not the case with the Sharon community, mashallah. Very good learners in this community, very bright, mashallah. So we have another question from A. Abdullah. Salams everyone, Jazakallah khair, Sister Hoda, Ujala, and Suzanne for planning this halqa. Ahlan wa sahlan, alhamdulillah, for the opportunity. Any advice on sanitizing grocery bags and produce from supermarkets? Jazakallah khair.
Yes. So, you know, in terms of, you know, so there is a wide spectrum of what is recommended in this category. But I'm going to tell you, I'm going to share with you basically what we know about the virus. So basically, this virus can live onto surfaces like plastic and metal for up to 3 days. And so if you imagine at the grocery store, whether it's people working there, and I know people have told me that they're wearing gloves, but a dirty glove can actually be as bad as a dirty hand. So, you know, if, don't get fooled by someone who's wearing a glove, because they may have touched their noses with that glove. But anyway, so basically, these are items that are being handled probably within the 72-hour period. And so it is safe and cautionary to wipe them down. And this is honestly what I personally do. You know, whether it is a Clorox wipe or a clean rag soaked in your favorite detergent recipe, you know, but it is some kind of disinfectant. And wiping the groceries, especially things like milk and juice bottles that you might be consuming in the middle of a meal. You know, you might be pouring things into a glass and then eating your steak or something, you know. So this is something I would consider wiping those down. Washing your fruits and vegetables, that goes without saying. Hopefully you're doing that regularly, but even being more careful with washing fruits and vegetables. I also recommend that you throw the plastic bags. Do not use reusable bags. Unfortunately, well, I mean, on a normal basis, I'm a big fan of reusable bags because it's good for the environment. However, these bags can be very dirty. if you reuse them. So plastic bags would be recommended, and just throw them. And it is safer. I personally do not bring the grocery bags in the house at all. I just throw them, you know, from the garage into the trash. If you are a very environmentally friendly person and insists on using cloth bags, then I would recommend washing them on high heat immediately after. And heat also destroys this virus. So hot environments and hot things will destroy this virus. So that is the answer to the question. Like, you know, it is, and also after disinfecting and wiping and throwing the plastic bags, also, guess what? Washing your hands. So, you know, making sure that you are safe and clean. Also, when you are grocery shopping, I think it's a good idea to have disinfectant wipes with you to wipe down your cart, and avoid touching your face while you are grocery shopping. So that, you know, you don't take something from the cart or on the groceries. So that's what I would recommend. Of course, you know, you don't want to, you know, one of my friends was joking about, like, you know, we're not gonna have coronavirus, but we're gonna have like OCD from all the cleaning. So yeah, this is a temporary phase, inshallah. Although some of the habits are good, you know, it's good to learn to wash your hands in general. But inshallah, if we exercise these, you know, practices, it'll be good for us and everyone involved, inshallah.
Inshallah. There was a video that was sent on WhatsApp. So my husband is a virologist, so he treats anything that comes into the house. He doesn't let it come into the house before it's sanitized. He treats it like it's a virus in a lab. So he wanted to do a video for the community, but alhamdulillah, a doctor in, I think, Texas or Arizona somewhere, or maybe Michigan, different parts of the geography, has done something like that. So we can share that, inshallah, as a follow-up to all the helpful tips that you just gave, Dr. Hoda. We'll share that on the Sharon WhatsApp, inshallah. Sister Leila has a question. Would you please tell me about taking deep breath and keep a few seconds, and hold the breath for a few seconds in order to increase the oxygen? Is this helping the immune system?
So we do talk about deep breathing as a treatment for anxiety, and it might help with general health as well. And what I can tell you about deep breathing is that most of us don't take deep breaths. We are utilizing just our chest, not our abdomen, for breathing. But in order to relax and in order to feel less anxious, there's a very, very simple tip of deep breathing where you just take a deep breath and hold it for like 5 seconds and then slowly exhale, and just do it like a few times. And just doing that helps a lot of people who are like about to have a panic attack or who are extremely anxious. It helped them reset. And under this, I also replied to her that there are a couple of apps available that you can download on your phone. One of them is called Headspace, which is currently it is free for healthcare professionals, but I think it's not free otherwise. But the second one, CBTI Coach, it's developed by the Department of Veterans Affairs, and it is free for anyone to use. And they have a lot of tips. They have a lot of small exercises about breathing, about using, you know, different kind of soothing music, or other like the white noises or from nature, and some of those are directed toward improving sleep. So utilizing them can also help with relaxation, and deep breathing will be covered there too. And someone replied, Insight Timer is a great app that's free. So there would be other apps, and we can utilize them, inshallah, to our benefit.
Inshallah. Brother Imran has asked a question that I think is on all of our minds. We want to know. He says, Sanams, when do you expect life to go back to normal? Months? Longer?
So, subhanallah, you know, I feel like this is probably the most asked question. I think everybody's so anxious for life to return to normal as we know it. And how long will this be our new norm? Subhanallah, everything is in the hands of Allah. But we have some predictions from epidemiologists and some projections. So basically, if you look at the curve for Massachusetts, and this is something that is available online for Massachusetts and the US. This curve, as I mentioned, is on the uptick. We are on the exponential end of the curve. Every day we have multiples of cases. And if you look at the peak, and this is exactly, the curve is exactly how they predicted it. So 2 weeks ago, they said we're gonna see the peak in 2 weeks. And it is exactly happening as it was predicted. So if we go from that prediction and follow the curve, you will find that the peak is around mid-April. The peak is around, specifically, if you look at the curve, it's around April 17th. That is where this is going to be the peak. And then after that, it will decrease. So our, you know, the silver lining of this is that from the medical perspective, from us as medical professionals, there's a lot of planning that is happening now. You know, trying to get everything that is needed for this, from what we're being told is coming. We are trying to prepare and make sure our communities are safe. So there's a lot of preparation that is happening. Inshallah, I pray, and this is the silver lining, I pray that all of these efforts are going to help us get through this, inshallah.
Yeah.
The other silver lining is that if you look in countries like China, for example, you know, the whole thing took about 3 months, but China was better prepared than us. So, you know, we don't know if we're going to follow the China curve, you know, but if you look, this is, you know, this is to defervesce and to go back to normal. You know, if that follows the projection, it will probably be in that time frame, 3 months or so. Now, there are other projections where, you know, the projection, if we find treatment, if we find a vaccine, there are people who are working tirelessly day and night trying to find a vaccine or a medicine for this monster. This is all in the hands of Allah. All of these people are, you know, given this knowledge and capacity by Allah. And so, you know, what we can do, and I urge everybody, is to keep praying. Don't underestimate the power of praying. Keep all of these people in your prayers. Everybody, you know, everybody who's working on this to protect us all, just keep everyone in your prayers. Mm-hmm. And the second thing is try to do your part in staying at home and not making that tip of the curve even worse than projected. Maybe it won't be as projected. Subhanallah, you know, nobody can predict the future, but this is the information that we have. So you know, this does not answer the question. You know, I wish I had like a crystal ball to know, but this is the time frame that we're looking at. And, you know, the norm, like who defines normal? Who defines the norm? The norm is what we have been accustomed to. But like Dr. Ujala said, you know, it's maybe we are put in this situation to try to come up with new norms, you know, new things that we value and appreciate, and new practices, you know, like family time and prayer and getting closer to Allah and being, you know, caring to each other. Like I saw the initiatives that ICNE is taking towards other people in need. subhanallah, there are some people that we didn't even know they needed this help, and now we know they need it. So maybe this is our time to all get together and to just, you know, repent and reflect and sort of figure out our new norm. You know, when you are in isolation or like in social isolation, you actually get to spend a lot more time with yourself. And maybe this is what we need to do, you know, but may Allah, you know, may Allah guide us all and make it all easy for us, inshallah.
Ameen. Ameen. And so I just had one question. After we reach the peak, you know, that will be maybe around the start of Ramadan or a little bit before. Do we go back to what the old norm was, going to the masjid, tarawih prayers together in congregation? Can you give us some tips on that?
There is, I mean, you know, there is a very, very strong belief that this virus is going to probably change our practices forever. And so I think that our practices will change a little bit unless they find a vaccine for this, sort of like what happened with the flu. Unless there is a vaccine for this, I think even if we are on the downside part of the curve, it is better to still exercise caution. Dr. Ujala, I don't know if you have thoughts about that.
I would first go back to the question about how long it will take. So I think we can, the answer is we don't know. It can take any trajectory, depends on how much we are able to control the virus, how, you know, and sometimes that's all about flattening the curve. If we flatten the curve, we will be inside longer, but that would be for the benefit for all of us. If we don't, then our healthcare systems will get overburdened and we will crash, and we won't be able to manage all the patients. What we can do is try not to worry too much about the future, take one day at a time, and just leave everything to Allah. We believe it. If it's Allah's will, maybe tomorrow the virus will mutate and go away completely. We don't know. So what we need to do is improve our faith and remind ourselves that, you know, this is all a test from Allah, and we have to take one day at a time and follow the, you know, recommendations and go, you know, and maybe we'll find a new normal, like Dr. Hoda said. The truth is we don't know the future. We cannot predict where we'll end up, and it all depends. There's so many factors, whether we'll find a vaccine, whether we'll find a new treatment, whether the, you know, virus will mutate, whether we are able to slow down this exponential curve or we are not able to. So what is in our control is to do the hand washing, do the social distancing, try to do our part. That's what we can do. And I think that it increases everyone's anxiety just thinking about what will happen tomorrow, what will happen in a month from now, what will happen in fall. And thinking about that is not going to be helpful.
Yes, take it day by day. We have 3 more questions. Looking at the time, we have 7 minutes left, so hopefully we can get to everybody's questions. Jay wrote, if I feel sick, I would go to my doctor or a hospital. The worry I have now is I feel healthcare providers are the ones getting infected in large numbers. How safe are healthcare providers? Could this make the situation worse?
So yeah, I mean, yes,
let's keep the healthcare providers in our prayers because they really are risking.
That is a very valid concern, and in general, the same principles apply. If you are sick with mild symptoms, meaning, you know, a little bit of a sore throat, a little bit of a muscle ache, and you are young and you are healthy, then by all means, stay home. Stay out of the doctor's office that may be more contaminated than your own home. Stay out of the emergency room. If you are having serious symptoms, so shortness of breath, severe chest pain, you know, something that is serious, then in that case, you need urgent assistance. You need to go to the emergency room because you need to be treated. But if you have mild symptoms and you just want to know if you have COVID or not, do not go. Don't. Just stay home and stay out of the doctor's office. And if you do have it, I mean, in an ideal world, if we have testing, you know, so I'm going to share a little bit with you. I don't want to take too much of the time, but basically, you know, there is a stage of an epidemic where we call it the containment stage. This is the first stage where we want to identify everybody. So we test more people, and those people who test positive, we isolate them so we can contain the virus. Unfortunately, the US has gone beyond that. We are not in the containment phase now. We are, you know, the virus is spread in the community. And so testing may not be relevant. Whether, you know, if you're young and you're healthy and you're having mild symptoms, you should stay home. Of course, you should always ask your doctor. So calling, as I mentioned before, we have emails, we have calls in by the thousands every day asking, should I come in, should I not come in? So you should always ask your doctor. But in general, this is what we tell patients. If you're young and healthy and mild symptoms, and you're not anybody who can infect, like if you have elderly parents, or if you have, if you are a healthcare worker, you need to be tested because you can infect these people. But if you're young and healthy and you're not in any of these categories, then if you have mild symptoms, you can stay home and avoid the doctor's office. But if you are in any of these categories, and you're right, healthcare workers are being infected and they are being tested because, you know, they can infect a lot of people. So in our facility, we test any, like if a healthcare worker sneezes, they test him because they don't want him to infect other people. And, you know, hopefully your doctor's office is vigilant with this. And so if your healthcare worker is sick, or if they are, if they have the virus, they will be out. They will not be seeing you. So I don't want you to fear the doctor's office or the ER. If you need to go, you need to go. But if you don't need to go, then stay home. And if you're in doubt, just call your doctor. You know, hopefully the system will be supportive of you doing this.
Another question from a sister: is it safe to let my kids play in the backyard? Where I live, there are some animals like deer coming out at night, roaming around my home. So I worry if there are insects that attach to them and fall down in the backyard, it would affect her children.
So I think that the same precautions apply as always. So it's okay to let the kids play in the backyard, but of course, if it's the tick season, then put the insect repellent on them. Mm-hmm. And you know, Lyme disease is endemic, so that's always a. And then obviously check the kids every 24 hours. They need to have a full inspection.
Yes. I'm going to skip the Ramadan masjid question because I think we covered that. The question was, Snams, would you expect masjid to be open in Ramadan? Would it be safe to do so? I think we covered that, unless you want to say anything further. Dr. Hoda, Dr. Ujala.
You know, again, as I said, it's all in Allah's hands.
Yes.
Based on, you know, subhanAllah, based on the information that I shared, I'm not sure. I don't think so. But subhanAllah, Anything's possible.
Anything is, yes. Akram wrote, could you please write down the name of the breathing relaxation apps in the chat?
I did answer that.
Yes, yeah. And then we have a question from YouTube from Sister Iram. Should we still be buying Dunkin' or pizza from outside? Takeout, basically.
I would not recommend going to Dunkin' Donuts because they're handing you food with their hands, and I personally would not recommend that. Pizza is different. What I would suggest, and then I can see what Dr. Hoda, what her point of view is, but I would say that if you ask for pizza delivery, then wipe off the box and then warm the pizza in the microwave, and then you can have it. That's what I think.
Yes, I agree with Dr. Ujala. So if it is something hot, if it is something that is not directly handled, then I think that that's okay. But if it is something that may be handled or coughed or sneezed on, then no.
Yeah, good point. And just one note from the board, ICNE board will decide on the situation of Ramadan based on the state and medical guidance. So let's pray it happens, and let's exercise lots of caution in the meantime, and lots of prayers, inshallah. I want to thank both Dr. Ujala and Dr. Hoda for taking up their time, answering the questions so insightfully. We have a lot of really good best practices that you have shared with us. So inshallah, we can take those and implement them to maintain healthy states of mind during this time and healthy families, inshallah. If there are any follow-ups, maybe we can share those apps on the ICNE group chat, the WhatsApp chat, inshallah. And we're right past 1 o'clock. So I want to thank you both so much, and for everybody who asked their questions and for participating today. Jazakumullah khair.
Jazakallah khair. Thank you, Suzanne. Thank you for having us. And I just want to say something. So yes. I read something, just to praise our masjid and, all of the masjids in Massachusetts. We have been sort of leading in the nation, like in terms of how soon we closed our mosques, even before, a lot of mosques and a lot of houses of prayer. So Jazakumullah khair for everybody involved in the masjid's leadership. Thank you.
Thank you. Assalamu alaikum, everybody.
Jazakallah khair, Susan, for bringing this together, and may Allah keep all of us safe and healthy, and both mentally and physically, inshallah.
Ameen ya Rab, wa iyakum al khair.
Jazakumullah khair.
Take care of yourselves. Assalamu alaikum.
Assalamu alaikum.